Welcome one and all. As you all know, radiographs are important adjunct in treatment plan of a patient. However, taking a good radiograph requires skill and expertise. I would like to share some useful tips and tricks which you may have overlooked but I'm sure will be helpful for you in your day-to-day practice. Many of us have faced difficulty in taking radiographs of teeth with long roots as we often miss the root tip. Here is a simple tip to overcome this. Place a sensor vertically such that the entire tooth is captured. Most often, when we try to place a sensor for mandibular projections, the patient tend to push out the sensor. This is because of their hyperactive mylohyoid muscle. To deal with this, I can give you two tricks. One is to place the sensor vertically so that the area of contact is reduced. Second one is to ask your patient to touch the tip of their tongue to the posterior part of hard palate. This will depress their mylohyoid muscle. Several times we get cases like this where it looks like the canal is calcified. This kind of cases makes us apprehensive to treat them. But there is nothing to be worried of as it can be just an artifact because of multiple metallic restorations which tend to absorb more of the X-rays. If we place the sensor vertically in this case, we will be able to concentrate maximum amount of X-ray onto the targeted tooth rather than the adjacent metallic structures, resulting in a better quality radiograph of diagnostic value. Patients with gag reflex pose a problem very often in clinics, especially for maxillary teeth radiographs. For such patients, keep them supine position. This will cause their tongue to fall back. In addition, distraction of patient can also be employed. Each of you can adopt your own ways to distract the patient. Asking the patient not to blink their eyes may also help. Ideally, there are two techniques to take radiographs: paralleling technique and bisecting angle technique. As far as endodontics is concerned, paralleling technique gives the better radiographs. But in cases where the patient has shallow palate, paralleling technique cannot be employed. To get results as good as when taken with the paralleling technique, here is a simple tip. Place a cotton roll between the tooth and the biting wing of the position indicating device. This will ensure the placement of the sensor as parallel as possible. Now, have you ever missed a canal or a root hiding behind the other? To avoid this, consider a second periapical radiograph. Take it either from a mesial or a distal angulation before proceeding with the treatment. This will reveal any hidden anatomy. In a multi-rooted tooth, identification of a buccal and a lingual root are often confusing. The trick for easy identification is if the radiograph is taken from the mesial angulation, then the root that appears first will be the lingual root and the other one will be the buccal root, and vice versa if it taken from the distal angulation. Now, certain conditions necessitate that radiograph to be taken from distal angulation. They are MB2, strip perforations, and middle mesial canal. If you see a radiolucency in percussion area, always search for a middle mesial canal as they may indicate a middle mesial canal. In some cases, we may notice the sudden narrowing or disappearing of the pulse space. This is called fast break. This should be taken into consideration while assessing the preoperative radiographs. If the root canal abruptly seems to straighten or broaden, or if the cause cannot be traced, the presence of a second canal in the same root or another root should be suspected and anticipated. If you get a maxillary molar radiograph which shows a canal that tends to be off-centered in relation to the root, does that mean anything to you? Of course it is. It can be either due to transportation or a missed MB2. Even though the access opening through a crown is not highly recommended, on occasion if one has to do so, consider taking a bite-wing radiograph as it could be helpful in measuring the depth and location of the pulp chamber. A patient reporting with sinus tract is not an uncommon scenario. If we are unsure of the offending tooth, we can just trace the sinus tract with the help of a gutta percha inserted through the sinus opening. If the gutta percha tend to bend on insertion, then spray the gutta percha with endofrost, which will make the gutta percha stiffer. I believe a good radiograph is a vital adjunct to come to a correct diagnosis, enabling the clinician to provide a quality treatment to the patient. Thus, I conclude my presentation with the hope that these tips and tricks will enable you to have a more stress-free endo practice. Thank you.